So here is a heart in anatomical position. We'll start with the anterior interventricular sulcus, which is the line that goes down in between the ventricle, the left and the right ventricle. Again, this line, anterior interventricular sulcus. Second is the coronary sulcus, which is the basically white rounded line that goes on top, or actually below, the right and the left atrium. So this line again is the coronary sulcus. Then after that there's the left atrium and the right atrium. Again, left atrium on top of the heart and the right atrium on top of the heart. Right below that it's the left ventricle and the right ventricle. Again, left ventricle and right ventricle. Then on top of it, it's all the arteries and veins. So first we'll start with the first one on the top. That will be the pulmonary trunk, which is the first hole on the anterior part.
Pulmonary trunk.
Pulmonary trunk.
Okay.
Right posterior to the pulmonary trunk, there's the aorta.
Okay.
And right on top of the aorta, there's the brachiocephalic trunk artery.
Where the pointer is?
Exactly.
The tip is?
Exactly. The top artery that goes out of the aorta, it's the brachiocephalic artery. On the posterior part of the heart, we look again at the left ventricle and the right ventricle. I'm sorry, at the left atrium and the right atrium. And on the left atrium, we can see the hole that's basically connect into the pulmonary veins. Again, this hole on the posterior part of the left ventricle, it's the pulmonary vein. And then on the posterior part of the right ventricle, right atrium, I'm sorry, again, posterior part of the right atrium, we can see the superior vena cava and then the inferior vena cava.
Okay.
That's the inferior vena cava and superior vena cava. Other than that, when we take the heart back to the anatomical position and we'll open the ventricles, we can see this middle muscle. This middle muscle, it's called the papillary muscle.
And that's on the right ventricle.
It's basically in between the ventricle. That's the right ventricle. This is the left ventricle. We can see that the right ventricle wall is really narrow versus the left ventricle, it's really thick. Again, this muscle in between, it's the papillary muscle, which is basically holding all the chordae tendineae, which are those white strings that are basically opening and closing the valves. They're either the bicuspide, which is located on the left ventricle, or the tricuspide, which is located on the right ventricle. That's pretty much it.